Okay, good morning. Good morning. Nice to see you all here today. I'm honored to be here to announce an expansion of the partnership between Cook County Health, University of Illinois Health, and University of Illinois at Chicago to better serve patients in this area and improve education and research opportunities. Before we begin, I'd like to acknowledge a few elected officials who I think are represented by their staff. State Senator Lakeisha Collins, State Rep. Omar Williams, and State Representative Moore. I think their staffs are with us, is that right? There we go, hands waved in the back. All right, good, thank you. Please tell them that I acknowledged them, huh? I didn't forget. I'd also like to thank Chancellor Marie-Lynn Miranda of the University of Illinois at Chicago, Dr. Robert Barish, University of Illinois at Chicago Vice Chancellor for Health Affairs, Dr. Mark Rosenblatt, Executive Dean of the University of Illinois College of Medicine, as well as the Cook County Health leaders who are here today. Dr. Dan McCormick, Executive Chief Clinical Affairs Officer, and Steve Axe, who is Chief Academic Affairs Officer. All right, today marks an important milestone in public health for both Cook County and the state of Illinois. I was saying to Chancellor Miranda earlier that one of the things that I discovered when I got this job in 2010 is that we had pretty deep relationships with Rush University and Medical Center, but not such strong ties to the University of Illinois, right here in the medical district with us as well, which I thought was a little odd since we're both public institutions. So I'm very glad to be here today to celebrate this collaboration. At a time when the federal government is retreating from its responsibility to safeguard the well-being of our American people, we're moving in the opposite direction. Cook County and the state of Illinois are standing together, united in purpose, and grounded in a shared commitment to the health of each and every one of our residents. Through this partnership, we're not only combining our strengths, we're reimagining what's possible in public health. We're aligning our resources, expanding access to care, and advancing the practice of medicine. This work is not simply about efficiency and cost saving, though those two are vital in our challenging times. It's about something more fundamental. It's about dignity. It's about fairness. It's about ensuring that every person in every community has access to high quality, affordable, and equitable care. Because health care is not a privilege, it's a right. As the political and economic landscape continues to shift, partnerships like this one stand as a powerful reminder of what good government and public institutions can do. Together, we're closing gaps in care, expanding access to specialty physicians, strengthening medical education, and advancing groundbreaking research that will benefit patients across our region. I want to express my deep gratitude to the exceptional teams at Cook County Health, UIC, and UI Health. Your collaboration and dedication embody the very best of our public institutions. When we work together, we can build more than systems of care. We can build trust, we can build resilience, and we can build a future where health equity is not an aspiration, but a reality for all who call Cook County home. Thank you. And now, it's my pleasure to bring to the podium Marie-Lynn Miranda, who is UIC Chancellor. No, you're next.
I'm next, okay.
That's what it says on the program.
On my notes, it says to thank Bob for introducing me. Anyway, thank you very kindly for the introduction and for allowing me the opportunity to say a few words. Good morning, everyone.
Good morning.
Oh, I love that she can do that. Thank you all for being here and for showing your support for bringing world-class health care to all residents of Cook County, Chicago, and across our state. I'm honored to be here for this important occasion. You know, we oftentimes hear about the power of public-private partnerships, right? Public-private partnerships. And to be clear, I am a fan of them. Public-private partnerships have created significant opportunities for our city, for our region, including at UAC. We hear much less about public-public partnerships. Today we celebrate what I consider to be a national model for public-public partnerships. We bring together the power of two institutions, both deeply committed to the public good and deeply committed to the idea that all people deserve world-class health care. Thank you, President Preckwinkle, for your leadership and your enduring vision of what's possible when we truly commit to quality health care for all. I also want to recognize, as President Preckwinkle did, the many leaders and teams who made this affiliation possible. From UIC, Bob Barish, Mark Rosenblatt, Heather Prendergast, and Vanessa Peoples, and from Cook County Health, Eric McItis, Stephen Axe, and Daniel McCormick. I know for UIC there was actually a big cast of thousands that actually helped make this happen, and some of them are here in the room, including Ray Curry, Prab Prabhakar, Janet Lynn, just a whole big group of people. So given what it took, the effort that it took on our side to do that, I know that there was a very significant team behind all of you on the Cook County side as well, and we're grateful to the entire team. To all of these individuals and to the many teams and leaders from both UIC and Cook County Health who have worked so very hard to make this partnership possible, thank you. We will accomplish great things together because we share both values and purpose to advance health equity, expand opportunities, and deliver the highest quality care to every patient, every family, and every neighborhood in Cook County. As an anchor institution right here in Chicago and the city's only public research university, UIC's mission is to provide the broadest access to the highest levels of educational, research, and clinical excellence. This partnership is the perfect expression of that mission, bringing world-class education, clinical care, and research to meet the urgent needs of our communities. Through today's agreements, we will expand access to clerkship rotations, clinical fellowships, and residencies for our students and trainees, build joint clinical services across more than 16 specialties, open the doors to wider collaborative research and clinical trials that brings tomorrow's discovery to the forefront of patient care, expand access to simulation training, continuing education, and leadership development opportunities, expand enrollment in clinical trials, and develop cost-effective models of care that increase both access and efficiency, because we do not have to sacrifice access for the sake of efficiency. These joint outcomes, or these joint efforts, will mean better outcomes, better coordination, and more innovation, all designed to ensure that every patient, regardless of circumstance, receives the care they deserve. The possibilities and the potential of this partnership are extraordinary. We're training the next generation of physicians to work across systems, to translate research into practice, and to build trust in communities that have too often been left behind. We are creating a model for how public institutions can lead together, a model grounded in accountability, transparency, and shared responsibility for the health of our neighbors. And we are sending a powerful message that the future of healthcare in Chicago and in our nation can be both excellent and equitable. To all who helped make this day possible, thank you. Thank you for your vision and for your hard work getting us to this day, but also, this is only the beginning. We have so much more good work to do together. I'm now pleased to ask Dr. Daniel McCormick, Cook County Health Executive Chief Clinical Officer, to say a few words.
Well, thank you, and good morning, everybody.
Good morning.
There we go. So I'm Dr. Dan McCormick. I am the Executive Chief Clinical Officer for Cook County Health. More importantly, actually, and I'm going off script, I'm actually a graduate of the University of Illinois College of Medicine in 1991, and a former Cook County medical student and surgical rotation. So this is all full circle for me, so thank you all for having me back. I am very humbled, actually, to be back, and I want to thank everyone gathered here from Cook County Health, UIC, and UI Health, who work behind the scenes and to make this all happen. And it's certainly a lot more than everybody that's been mentioned. I see everybody in the audience here from at least the Cook County side, and I can say there's been a lot of work going on from everybody here. I'd also like to thank President Preckwinkle, the Cook County Board of Commissioners, and the Cook County Health Board of Directors for their continued support of the work. And lastly, I'd like to acknowledge Eric Makaitis for his continued leadership, his vision of our system, as well as Andrea Gibson, our Chief Strategy Officer, right there. Thanks, Andrea. So today's announcement represents another milestone in how we deliver care at Cook County Health. By expanding our partnership with UI Health, we are creating new pathways for patients to access the care and expertise they deserve. For nearly 2 centuries, Cook County Health has evolved to meet the needs of our patients and the communities that we serve. From our initial days as a small almshouse to the expansive network we have built, this announcement is just another step in growing the changing times here in healthcare. In public health, combining strengths and leveraging partnerships allows us to deliver high-quality care more efficiently and to be good stewards over the public resources we are provided. This partnership allows us to coordinate care across our systems, ensuring patients receive the care they need where they need it. Together, our systems are building a stronger and more equitable model of care that can meet the needs of patients now and into the future. Accessible and exceptional for all. Thank you. I'd like to now take the opportunity to introduce my new friend, the Vice Chancellor of Health Affairs, Dr. Robert Parrish.
Okay. All right, I'm going to say good morning.
Good morning.
I love when she does that. Oh my gosh. Thank you for the introduction. You know, when I walked in this morning, I saw so many people from Cook County Health and the university who said, you know, Bob, this is at least 10 years in the making. 10 years in the making. So it's quite a day, and I want to special thanks to Tony, to President Preckwinkle, Chancellor Miranda, and our many colleagues and friends with us today to commemorate this partnership among Cook County Health and the College of Medicine and UI Health. As you've heard, this collaborative partnership will bolster our shared mission of delivering quality health care for all by combining shared resources across clinical, educational, and research fields to improve community health. Indeed, this is a transformative public-public partnership that many have mentioned already that will expand access to educational and training opportunities for medical students while also developing clinical services across our organizations. We are pleased that this agreement will provide the pathway for recommendations for cost-effective care models and expanded access to enrollment in clinical trials. This extended partnership between Cook County Health and UI Health is still just the beginning. By continuing to design shared frameworks like this innovative partnership, UIC and UI Health are committed to the future of healthcare for all in Chicago, the state of Illinois, and beyond. So finally, in closing, I would like to offer my sincere gratitude to the leadership across our organizations for making this agreement come to life. It is now my opportunity to welcome to the podium Chief Academic Affairs Officer for Cook County Health, Dr. Stephen Axe. Stephen.
So I'll start with 2 things. Thank you for that introduction, Bob, and good morning.
Good morning.
All right, thank you. I'll go off script for a second, and I'm Dr. Steve Axe. I'm the Chief Academic Affairs Officer. That's why I'm here today. But I will say I'm an emergency physician and a medical toxicologist. I've run the Toxicon Consortium, which is a partnership between us and University of Illinois since 1988. So I just want to say that we have a template here. To me, this collaboration is a no-brainer. We are mission aligned, so I'm very excited to be here and to be working in this role. So again, as Chief Academic Officer of Cook County Health, I have some remarks. This is a very exciting day for us here at Cook County Health. We look to expand access to care and opportunities for our patients. As the Chief Academic Officer, I'm also excited about what this means for our physicians, trainees, and medical students. This collaboration creates new opportunities for them to learn, to teach and grow and strengthen the next generation of clinicians who serve our communities. I'll just also add that The first medical residency in the United States is here at Cook County, and honestly, being linked with the university, this is how I see mission alignment. We want to continue this legacy far into the future. This will allow for opportunities for physicians, researchers, and trainees to collaborate, learn, and deliver care in ways that will improve patient outcomes. This is what drives progress and equitable access to care. By expanding opportunities for learning and discovery, we are strengthening our respective missions. Meanwhile, the expansion of access to simulation education, new academic pathways, critical tools for physician development, recruitment, and retention in today's challenging healthcare environment, these will be wins that we'll have in the future. And from the research side, we're opening doors for collaboration and making clinical trials more accessible to the communities that we serve. This will ensure that research and discovery will benefit all and not just few. And I do believe it's a duty for us here at Cook County to participate in describing the important findings in our patient populations and driving their care forward. As the healthcare landscape continues to evolve, partnerships like this are critical to ensure the education and research can continue to grow and thrive. Thank you to everyone who's worked so hard on this collaboration behind the scenes to bring it to life. I'll also single out Andrew Gibson, who kept this show moving on our end, so thank you very much. This effort reflects our commitment to learning, collaboration, and serving those who need it. I look forward to all that we'll accomplish together to benefit those we serve. Thank you very much. And who's up next? Okay, sorry.
Well, thank you very much. And first, I will start by wishing everyone a very, very good morning.
Good morning. Good morning.
This is such a special day for UI Health, the University of Illinois College of Medicine, and Cook County Health, with whom we are so pleased to be partnering in this public-public agreement. We've been looking forward to this day for quite some time. We've been at it for a couple years. And I want to share my deep gratitude to everyone who works so hard and so diligently to make this day happen. It's a testament to the resilience and persistence of our organizations. Between us, we have an extraordinarily rich history of providing advancing healthcare for all. This partnership focuses on harnessing our collective expertise. And this agreement, of course, builds upon our 2021 partnership in pediatric care. I think we all knew at that time that this was just the beginning. As Executive Dean of the College of Medicine and CEO of the University of Illinois Hospital and Clinics, I'm fortunate to see this agreement from multiple perspectives. And I'm so excited about what this means for students and trainees as well. Medical students will have expanded access to clerkship rotations at Cook County Health. Students in the urban medical education and graduate medical education programs at the college will receive additional experiential education. We expect that the expanded residency and clinical fellowship opportunities at both institutions will foster an environment of specialty care expertise and seamless referrals for intricate patient care across Cook County Health and UI Health providers. The partnership will also have a profound impact on the translational sciences by catalyzing innovation in training, research tools, and processes. Students will also be able to study and deliver novel treatments as part of their curriculum, with the goal of instilling future confidence in diagnostic and applied healthcare. Cook County Health members will have opportunities for promotion on the College of Medicine's non-tenured clinical, teaching, and adjunct tracks, and access to shared resources such as our library of the health sciences and electronic databases. Simulation is an important part of our students' training at the college. We're proud of growth and expansion in simulation, including the Simulation and Integrative Learning Institute, a $25 million endeavor with its expansion in 2019, and also the opening of our Surgical Innovation Training Lab in 2020. We're thrilled that this partnership offers Cook County Health staff and students and residents access to medical education and simulation through the College of Medicine. Research is one of the key pillars of our college. It really would make academic medicine special. And this collaboration will augment the impact of both partner institutions by capitalizing on the potential global impact of the two organizations' impactful research portfolios, while creating additional research opportunities for the College of Medicine and Cook County researchers. We anticipate this agreement inspires future partnerships with nonprofit and for-profit entities. In the end, this partnership just made common sense. And we know common sense always ain't so common. We made it happen. And in speaking with Dr. Keene just before, he noted that this rapprochement really began 10 years ago. And this day marks an important milestone. It's not a revolution, it's an evolution of work that's been done over 10 years. And we look back several decades from now, we'll see this day as a milestone in what is now a world-changing partnership between Cook County Health and UI Health. So this is, of course, the culmination of works of dozens of people. I could spend the next hour describing all of those pieces of work, but just to thank the dozens of people involved in making this happen, I will highlight one, because I get to introduce her. That's Dr. Heather Pendergast, our Associate Dean for Clinical Affairs and Executive Director of our Physicians Group. Heather is the irresistible force who's never met an immovable object. So Heather.
Go, Heather.
Thank you so much, Dean Rosenblatt, and I will start with a good morning.
Good morning.
Okay, it truly is a privilege to be here today to celebrate this important milestone for our shared journey towards advancing health equity and excellence in care. I've been a faculty member at University of Illinois College of Medicine for over 28 years, and I had the honor of serving on the Cook County Health and Hospital Board for 5 years. So I can tell you that the commitment to our patients and the communities that we serve is real, and it is deeply rooted, and this is a very meaningful partnership. This partnership will allow us to elevate the framework for world-class physicians, educators, and researchers to expand their work, collaborate, and share expertise across institutions. In many ways, what we're doing here today, this celebratory signing ceremony, stands on the shoulders of our successful partnership for pediatric care launched in 2021 between Cook County Health and UI Health. The Partnership for Pediatric Care, using a shared services model, has resulted in over 318,000 outpatient visits on an annual basis, giving children of Cook County and children across the state the best chance at a healthy life. So you see, together we're developing a new model of care that is built on the strengths of both of our institutions. As public institutions, we share a common mission to provide the highest quality care to all patients and to improve the health of communities across the county and the state. I'm excited because this partnership will really allow us to amplify our collective impact. Together, we are reaffirming our unwavering commitment to serve, build healthier communities, and a healthier Illinois. And so now I have the distinct pleasure of asking the leadership and our officials to come forward for the signing ceremony. Thank you.